Okay, hi, good afternoon, everyone. My name is Jim. Today my topic is on asthmatic and cough. Also, we'll look at how Ganoderma can actually help on this two health problem. Yeah, so the ancient Greek came up with the term asthma. It means short, grasping for breath. Yeah, next. So first we look at the disclaimer. I think note that the information presented here is mainly for training. Okay, now we look at what is a respiratory system and how it works. So the respiratory system is actually made up of organs and tissues that actually help you breathe. So when we inhale, it actually deliver oxygen to the cell in your body. Yeah. So when we exhale, it remove waste gases, including carbon dioxide, from the body when you exhale. So breathing actually starts when you inhale air into your nose or mouth. So it travels down the back of your throat, called pharynx, voice box, and then into your windpipe, the one called trachea, which is actually further down. It actually go further down. It actually divided into air passage, okay, into bronchial tubes. So the bronchial tube will actually come into two lungs, okay, at the end of two lungs. So as the bronchial tubes pass through your lungs, they actually divided into small air passage called bronchioles. That's just a tree branch. They actually branch out from there in the lung. So the bronchioles will actually end in a tiny balloon-like air sac kind of thing. The endpoint, there's an endpoint for the connecting bronchioles. The endpoint, the air sac is called alveoli. So your body has about 600 million alveoli. So these alveoli are surrounded by a mesh of so-called tiny blood vessel called capillaries. So oxygen, when you breathe in all the way to this endpoint alveoli, is actually, this is the point where they do the exchange, okay, the gas exchange. So oxygen from an inhale will actually pass into the blood via the blood vessel, the so-called capillaries. So after absorbing the oxygen, blood actually to the blood actually go to the heart. Yeah, your heart will then pump it through your body to the cell and the rest of tissue and organs. As the cell use the oxygen, they actually make carbon dioxide. So that goes into the blood. So just now the alveoli, while they actually deliver the oxygen to the bloodstream, they at the same time also get the carbon dioxide from the blood. Yeah. So when they exhale, they actually move out the carbon dioxide. Yeah. Yeah, next. So now we look at the anatomy of the respiratory system. There are three major parts. Yeah. Airway, lungs, and respiratory muscle. Yeah. So the airway include, okay, nose, mouth, pharynx, which is the throat, and the trachea, bronchi, and bronchioles. So these are all the components from the airway all the way, and it's the main air passage to our body. So for your lung to actually perform their best, these airways need to be clear and open. Okay, so the next component, the next part is the lungs. So lung act as a functional unit of the respiratory system by passing oxygen into the body and actually get the carbon dioxide out of the body. So the exchange of oxygen, and yeah, just now mentioned about the exchange, it actually take place in the alveoli. So this lung is actually like a balloon like that. So they actually having the activity of compress and let the air suck in and then blow out the carbon dioxide. So it's actually through the diaphragm supported by the lung. So the diaphragm will actually push up, okay, the push up, contract, and then get the lung pump. They have a pumping effect so that we can actually do the proper breathing. Next is the respiratory muscle. So this is, just now we mentioned about the diaphragm, which is the intercostal muscle, work together to actually act as a pump. So pushing the air into and out of the lung during breathing. Yeah. So yeah. So next. So now we look at some numbers, okay? In worldwide, number of people with asthma is about 334 million people, yeah? So this is the data collected between 2008 to 2010. So it estimated additional about 100 million people by 2025. This is a prediction, so based on the trend. And as for in Singapore, about 5% of adults and 20% of children having this asthma problem. So there's a launch of a Singapore national asthma program to look into how to improve this asthma disease and to control it. And the hospitalization, okay, in 1994, it actually fell from 7,000 to 3,008 in 2004. So this program actually helped. In the last 6 years, the number of so-called adult patient admitted to actually ICU has actually increased almost 30% annually. This is based on the Health Promotion Board data 2013, but that last 6 years means actually reference back from 2013. Yeah. So one of the 5 leading causes of disease burden in 65 years old and above. So about 5.8%. That's where we get 5%. So one of the 4 leading causes of disease burden in children, okay, range from 0 to 14 years old. Yeah. So next. So what is asthma? So asthma is a reversible narrowing of the airway in the lung. Why actually, what it means is that this symptom can actually go back to normal when it is not triggered. So in other words, that actually you are able to control and prevent if you know what to avoid. Yeah. So that's why they say it's a reversible narrowing of airway. So the airways is the so-called is the one that causing the so-called this asthma problem. So it's actually caused by the sensitive reaction of this airway to various trigger. So sometimes asthma attack can actually go away, okay, just by getting avoid. Okay, if you know the source, you can actually avoid all this source. And if it's this so-called not treated, it can be life-threatening. Yeah. So sometimes asthma attack can be actually triggered by allergen or air pollution. So the airway become very sensitive and inflamed. So the inflammation will cause this airway to be narrow and may eventually limit the airflow, the oxygen that we breathe to supply to the lung. This is limited by this because of limited space of the airway. So when that happens, you will actually get the so-called asthma symptom. Okay, so example, cough, wheezing, and breathless. So if you look at the bottom left picture, you look at the airway, the three, yeah. So on the extreme left, so when that is a under normal condition, which is under the good condition, you breathe in normally, the airflow will actually flow very smoothly, and your lung perform the best. Yeah. So the second picture in the middle, which means you have some inflammation. So the lining of the internal airway become a bit swollen, and you get smaller space for the air for oxygen to move in or the carbon dioxide to move out. So it become a very limited space for the air to move. Yeah. So the third one, you get worse because the muscle around the airway become very tight, very tighten. So when they tighten, the muscle tighten, it make the airway even narrower. So the air cannot even pass through. That's where you get actually short of breath. Okay, so this so-called, in addition, during the attack, your body may actually create more mucus that is so thick that it actually clog the airway. So that's why it's quite life-threatening if we don't treat it, yeah, immediately. Yeah. So symptoms, just I mentioned about the limited space in the airway that we have. So the wheezing sound, we have cough. So you can think of it like whistling through a narrow tube. So you got the sound. And cough, you have a very severe cough, and particularly at night. So you affect your quality of sleep. Yeah. So the last one will be difficulty in breathing, and that also cause you the chest tightness. Yeah. So the complication would be, end up will be pneumonia. So pneumonia will actually is an infection of the lung. Yeah. So the respiratory failure may actually, the complication become respiratory failure. So in that sense, is the oxygen level in the blood is actually very low. Okay, so you don't have enough supply of oxygen to your body. So you may experience shortness of breath, headache, and confusion. So the whole body need oxygen. That's why we can actually live without food for 2 days. We can actually live without water for 2 days. Yeah, for longer time, but we can't live without oxygen, air for 2 minutes. Yeah. So the causes now will be changes in temperature and weather. It will actually cause the so-called this asthma. And tobacco smoke and wood smoke. Yeah, so these are the causes. And it may actually allergic to some of the dust mite, pollen, or mold, or animal day. Yeah, so all these are allergens that will actually trigger the asthma. Yeah. Yes. Yeah. Yes. Okay, why asthma happen in only certain people? So giving the same environment, there are people who actually got asthma, but those normal under the same environment, some people will get it, okay, because they have asthma, they get triggered, but some don't. So because of asthma, those people with asthma are those who are very hypersensitive. They are actually hypersensitive. The body, they actually react aggressively to kind of allergen, okay, as compared to those who are not so sensitive. The body, they are not so sensitive to react to allergen. So that has to do with our immune system. Okay, our immune system, for those for the immune system that are very overreact and produce too much of antibody. In fact, they will actually tends to cause overreact allergic reaction. So immune system, we look at Th1 and Th2 cell play a very important role in the immunity. So for Th1 and Th2, they belong to a T hyper cell. Yeah, their role is Th1, so-called T hyper 1. So this is the hyper cell Th1 that actually activate the macrophage to kill pathogens like virus and bacteria. They have actually engulfed. So phagophage is a type of a white blood cell that actually help to eliminate foreign substance. So that when the body detect, okay, these are the point that where they detect the foreign substance, phagophage will actually be activated to go and engulf it, swallow it, okay, and at the same time initiate the immune response. And then for Th2, the T hypercell 2 is actually mainly activate the B cell. So once they got activated, they will actually secreted a lot of antibodies. So it will react to the reported, so-called when you report this is the allergen, they will treat this as an allergen. So TH2 will actually activate to go and fight the allergen. Yeah. So TH1 and TH2 has to maintain a balanced position in the so-called in our body. So it's just a seesaw. It's either you have more TH1 or less TH2. You can't have so-called it's a relative. So TH2 must be always lesser than TH1. Yeah. So for asthmatic body, TH2 is way too high. They produce too much of the so-called antigen. So they treat a lot of things as allergen. And then they produce a lot of excessive immunoglobulin E. So for normal people, normal body who don't have this so-called hypersensitive, they actually TH1 is stronger and TH2 is so-called weaker. So given the same environment, they will react normally to allergen. Yeah. So long-term inflammation of airway may actually cause irreversible damage to the airway. So now we look at irreversible damage. So what it means that if you have inflammation for too long that is not treated, and you leave it and you just the consequences would be permanent damage to the airway. That would be very bad because throughout the time they actually inflame, then they get more mucus, then they actually choke the whole airway. Yeah. So the third one, and most of the time, asthma can be better. It actually can be get better after when you're reaching the adulthood. What it means that when you're young, you may have asthma, but when you grow older, it becomes better because TH1 being trained to become stronger than TH2. So when you grow older, yeah, in general, this is the case. So still have chance, but take note that it may still have chance to actually relapse after adulthood. Once you get triggered, it will actually become the other way around. Yeah, TH2 becomes stronger. So fourth is so now we know the root cause and we can actually address by regulate our immunity. So which means to maintain a balance of TH1 and TH2. Okay, we are trying to achieve a balance. So meaning that TH1 is higher than TH2, not the other way around. Yeah. Next. So why am I coughing? So our body is very smart. So when something irritates your throat or airway, the first response is that your nervous system will actually send an alert to your brain. So that purpose of a cough is to actually remove foreign particle and bacteria to prevent possible infection. So that's why when inhale, exhale, all this action will actually cause the so-called the pathogen, the so-called the virus or bacteria actually stay in the mucus and the wall. So when you breathe out, they actually push out. So coughing, so the first one is that coughing is a common reflex action that actually clears your throat of mucus or foreign irritant. Yeah. So number two is if a cough lasts for less than 3 weeks, so this is it is an acute cough. So it most caused by viral infection or some infection in the upper respiratory tract or common cold. So if it's a lower respiratory tract, it's a acute bronchitis. Yeah. So this most episode of coughing will actually clear up at least within about 2 weeks time. So if your cough lasts between 3 and 8 weeks, so this condition then improve slowly by the end of the period, maybe about 7 and 8 weeks. It considered a subacute cough. Yeah. So, but if a cough lasts more than 8 weeks and you don't seem to improve, and then it's very persistent, and it causes a lot of so-called problem at night or during your sleep, that is a chronic cough. Yeah. Fifth is that you should see a doctor if you cough up blood. or having a so-called barking cough. So if your cough hasn't improved within a few weeks, as this could indicate some more serious problem. Yeah, so see a doctor for advice. Next. So following the causes why we cough. Okay, first one is that clearing the throat. So because of a need to clear the throat, so coughing in fact is a standard way of clearing your throat. So when you have foreign particles such as dust, smoke in your airway, okay, so this is quite a normal reaction our body will behave. So number two is that it could be actually caused by virus or bacteria. Okay, so when we breathe, air will tend to have those virus or bacteria that actually in some condition we will have the so-called respiratory tract infection. So sometimes you'll get cold or flu. So this infection is caused by virus and it may actually last a few days to a week. Yeah. Third, it could actually due to smoking. So chronic cough with a distinct these will actually have a so-called distinct sound. So also known as a smoker cough. Yeah. Fourth is the asthma. So you have asthma, then typically asthma coughing is actually very easy to identify. It's actually wheezing, yeah, wheezing sound. Yeah. So these are easy to identify. So sometimes medicine also can cause you having cough. For example, some of the angiotensin converting enzyme ACE. So this is the so-called the medicine inhibitor. Is a inhibitor for commonly to treat those high blood pressure or heart condition problem. So this can also cause coughing. Yeah. So example like Zastri and Vasotec. Yeah. Vasotec. Yeah. Vasotec. So six is that also can be due to other condition. Example like if you have damage to your vocal cord, okay, it's caused by some vocal abuse, like you talk too much, talk too long, or shouting, or coughing too hard, smoking, or constant clearing the throat. Yeah, so this will actually cause the cough. Now, another one will be postnatal drip. So this is the so-called the mucus actually secretion moving down from the back of the throat and often cause coughing. Yeah. So the other one will be caused by the serious condition, for example, pulmonary embolism and heart failure. So this is a so-called blockage. It's a potentially life-threatening condition where a blood clot travel usually from the leg to the lung. So it causes actually causing sudden shortness of breath, and sometimes it's a dry cough. So this one can be quite life-threatening because the blood flow is not smooth and it block the flow to the lung. That's why it may actually have the symptom of a so-called coughing, dry cough, and then so-called like symptom like a heart attack kind of stuff. Yeah. So this one can be life-threatening. Yeah. So the next one will be the so-called the gastroesophageal reflux disease, GERD. Yeah, so this happens when the stomach acid frequently flow back up into your esophagus, so causing the heartburn. So when this acid rises into your throat, it can actually cause a dry cough. Yeah, so all these can be a cause. These are the causes of why we cough. Yeah. Yeah. So next we look at the treatment. So treatment for asthma usually involve learning how to recognize your trigger. and taking steps to avoid trigger and tracking your breathing to make sure that your medication are keeping symptom under control. So prevention and long-term control are key actually to stop asthma attack before they actually start. So we'll look at the so-called what are the drugs used for control the symptom. So there are three. So the first one is a preventer. Yeah. So preventer is a kind of so-called to reduce swelling and mucus. So this preventer anti-inflammatory agent. These are the inhaled steroid. Yeah. So these are used to keep your asthma under control on a so-called day-to-day basis. So they are it's supposed to actually so-called daily maintenance to make sure that you control your asthma attack to prevent the airway from injury. Yeah. So the next one will be the reliever. Yeah. So the reliever, these are used okay as needed for rapid short-term symptom relief. Okay, during the asthma attack. So this will actually have the effect of to reduce your airway muscle, thereby opening the airway wider. Okay, that help because during the attack, the airway is become very small. Okay, because of you get inflamed. So this one will actually this so-called reliever will actually help to relieve the asthma symptom within minutes, used in acute asthma attack. So do take note that the preventer, when you use when to use the preventer, when to use the reliever. So preventer is not effective when you have acute. So preventer is a so-called this steroid this inhaled steroid is actually very slow effect. It take longer time to take the effect. So if you have acute attack, you need to use a reliever. That's why they have two difference. Yeah, these two different drugs for different usage. The last one is that the treatment also having a different stages. So asthma treatment on different stages, they have early, intermediate, and advanced. So the early one, they actually doctor will actually give antihistamine. They actually give mast cell stabilizer and leukotriene inhibitor. Then if the condition is under the intermediate, they will actually give the steroid-based inhaler. So these are cortisol steroids. Then if you are in the advanced stage, okay, more serious, so the steroid will actually given as either oral or injection. Yeah, prednisone, and or the other one will be steroid-based drug. Okay, or long-term use. But for this steroid, so-called drug, although it's safe, yeah, so need to be proper administration by the doctor. So this so-called for the advanced treatment, the long-term use can cause bone thinning, weight gain, and high blood pressure, or an infection, etc. So this one have to be proper administration by the doctor. Yeah. So these are the treatment for asthma in terms of medication. Next. Yeah. So trigger can be different for each person. Yeah. So it is important to find out your source of trigger in order to actually prevent and avoid the so-called asthma attack. So for self management, what we can do is to avoid and eliminate factors that can actually trigger the asthma attack. So you can use so-called air filtering, vacuum cleaner, or frequent cleaning, or changing the bed and blanket to actually keep your environment clean. Yeah. And another one that you can actually do is to cut down your fried food, so that actually increase your chance, so that this fried food won't have a chance to actually increase your chance of so-called inflammation, because some of the food, some of the fried food, or some of the food that they have those preservative and artificial coloring used in this food. So it's advisable to take more vegetable and fruits. Next is to actually exercise, especially swimming. it's good for the lung. So adapt, so swimming or exercise, actually you are trying to adapt to changes of the surrounding temperature and humidity, so that you can actually increase the vital capacity of the lung. So in fact, regular physical activity can actually decrease the so-called asthma symptom by improving your lung health and decrease inflammation. Yeah. Yeah. So next. Yeah. So now we look at the so-called the health supplement, Ganoderma. So Ganoderma is also known as Lingzhi. It's a very special type of mushroom that has the healing property. So it has been recognized as a medicinal mushroom for over 2,000 years. So it's a powerful effect that have been documented in two of the oldest medical book in ancient China, 神农本草经 and 本草纲目. So in the last 50 years of modern scientific research, okay, in Lingzhi, we can actually find many evidence-based reports published. So do a Google search at the keyword Lingzhi or Ganoderma and diseases. We can actually easily get more than 1,000 search showing the research paper published. So, and almost all the report can be found in the PubMed website, which is the US National Library of Medicine. So all this you can actually do a Google to check for more details. Yeah. Next. Yeah, when it comes to selecting the so-called Lingzhi product, you will be swiped for choice in the market. So why would you choose Shuangho? So first, Shuangho is one of the world leader in producing top quality so-called Lingzhi. Yeah, their main core business is in researching, producing, and marketing Lingzhi. And the company has been in the business for more than for 32 years, specialized in producing top-grade Lingzhi product, and the head office in Taiwan and named as Double Crane. So but in Southeast Asia, their company name is Shuangho. So the company owns their in-house R&D, Lingzhi farm, as well as the distribution network. Yeah. So through many years of so-called research effort, which is patented extraction process, all Lingzhi products are extracted with two unique components, catechinoid and micromolecule polysaccharide content. Yeah. So, and the product has been scientifically certified with various endorsements, yeah, such as the SG, HSA, TQF, Taiwan Quality Food, Halal certified, as well as ISO certification. Yeah. Next. So function and benefit. What are the four key benefit of taking Lingzhi is that it take care of the immune system, the blood circulation, the liver, and remove the free radical cell. First, we look at for immune system. So for immune system, is actually regulate immune system to prevent overreaction to allergen. So immune system cannot be too high, cannot be too low. So if it's too high, they will actually regulate, yeah, for our body. And next is the alleviate release of histamine that actually lead to inflammation. So histamine is the chemical actually made by our body, and it is part of the defense system. So their purpose is very simple, is to fight against the foreign invader. So in the case of the so-called allergic reaction, it is because of the overreaction of the body that actually produce too much of the histamine. Yeah. So the next point is that regulate the immune system to actually help to maintain the Th1 and Th2 at the optimum balance level. Yeah. So this is what Lingzhi do for immune system. Next, we look at Lingzhi help to improve our blood circulation. So asthmatic lead to poor blood circulation. So during asthmatic attack, your lung get less oxygen, air. So your heart will actually pump faster. and trying to get more oxygen for the blood. So blood circulation, although over here is important to ensure that because of the oxygen is getting less, so oxygen must actually continue to flow to the rest of body. So with this improved blood circulation, we actually help to actually get enough circulation quickly to the body, supply to the body. Yeah. And third is a liver function, enhanced liver function. So taking Lingzhi can actually help to prevent liver damage for patients with actually steroid dependent asthma. Lingzhi not only help to protect the liver, but enhance its liver function. Fourth is to remove free radical and antioxidation. So with free radical, especially the superoxide O2, are increased for asthmatic patient. Yeah, so these are the 4 key benefits of taking Lingzhi. Yeah. Next. So the next 3 slides, we will show you the study of what so-called Ganoderma or Lingzhi can help in asthmatic on 4 areas. The first one will be relieve cough, reduce phlegm, and third, elevate asthma and lessen the inflammation. The fourth one will be induce immune system for Th1 development. So for the first one, first study, we will look at the so-called relief cough. The study have actually induced the mice with inflamed airway that actually produce more mucus, which actually lead to cough. So from this study, they actually found that the cough-induced mice with the Ganoderma extract induced mice, and they feed them with Ganoderma extract injected, and show their cough is being relieved because they actually look at lab observation on their airway. Yeah. So they also the healthy mice with the healthy mice, they actually fed with the Ganoderma extract. The observation found that they will not cough easily. Yeah. So in summary, the Ganoderma, on this study found that is having the efficacy of able to relieve the cough and also able to actually prevent the cough. Yeah. Next study is on reducing the phlegm. So in the lab test, they also did get the mice actually feed with Ganoderma. They found that they are able to clear the phlegm in their airway. So and the study also found that the asthma, those mice with asthma, they fed them with Ganoderma. They found that the BALF protein being able to actually reduce. So this so-called this BALF protein being reduced, the result will actually reduce the phlegm. So BALF is so-called one of the protein is thought to actually contain the immune cell found in the lung alveoli and can therefore actually provide a very important information regarding the immunology response that takes place. Yeah, that's why they are actually look at this protein BALF. So in summary, Ganoderma is able to help to reduce the phlegm from this study. Yeah, next. Okay, next study is on how Ganoderma work on alleviate the asthma and lessen the inflammation. So the first one, study on the relief, alleviate the asthma. So 30% of asthmatic mice, they actually have breathing difficulty and not able to actually stand up due to the spasms, and they actually fed them with Ganoderma extract, and they found that they are able to alleviate the so-called the asthma. So, but if the Ganoderma is used before inducing the asthma, the observation found that some of the mice are able to escape with asthma, and they would need longer time to actually induce the asthma. So another point is that the affected sponge away muscle is able to smoothen with the when they actually feed them with the Ganoderma extract, Ganoderma GN. Yeah. So in summary, for this so-called study, they actually found that Ganoderma is able to actually elevate the asthma and prevent. Yeah. And point number 2 is that they also found that the Ganoderma is able to ease the breathing difficulty because of the increased exchange of oxygen and carbon dioxide, according to their so-called clinical research. So the last one, the third one is as for the inflammation study, they actually found that for the so-called Ganoderma, the LZ8 protein is actually able to regulate their immune system for those mice that actually overreact to the dust mite. The research also found that the terpenoid is able to elevate the release of histamine. Yeah, that actually this histamine that lead to the inflammation. So as a histamine is, because histamine is overproduced during the allergic reaction. Yeah, so terpenoid is able to actually elevate the release of that. And Ganoderma suki is a so-called a type of so-called Ganoderma. Is also able to elevate the bronchi veolar inflammation in an airways sensitization. So includes decreasing differential cell count and the infiltrate the leukocyte. So these are all the so-called able to elevate the inflammation in the airway. Yeah. So these are quite of the so-called lab tests for the inflammation study. Yeah. So next. So next we look at the study on the immune system for Th1 development. We know that the Th1 and Th2 T hypercell play a role in the asthma. So what we want to achieve is to have high Th1 and low Th2. So for allergic condition, Th2 is too high. Yeah. So chances to induce a Th1 is getting nowadays is getting less. So the Th1 induced due to natural healing from illness is getting less. So nowadays is due to over dependent on vaccination, clean environment, and overprotective on the children. So reduction of good bacteria due to overuse of antibiotic will reduce the chance of inducing Th1. Yeah. So basically, now our doctor believe our so-called our immune system now has actually switched from fighting infection to fighting allergen because of our urbanized clean environment. So this is what our body now Th1 and Th1 in out of balance. Yeah. So to induce immune system for Th1 development. So those mice actually fed with LZ polysaccharide actually help to actually convert T cell to Th1. And they also found that LZ8 can actually increase the Th1 concentration. So in the cell experiment, actually they found that Lingzhi helped to actually increase the concentration of Th1 and elevate the Th2. Yeah. So in summary, regulate Th1 and Th2 is the so-called is the root cause solution for asthma and to actually maintain a balance in the stable condition. Yeah, next. So for dosage, use reference to Yongkian Ganoderma. Yeah. So for prevention is a 4 to 8 capsule, and for therapeutic, okay, pre-illness level is 12 capsule and above, and for mega dose is 30 capsule and above for actually intermediate and advanced level as a complement treatment. Yeah. So as for vertical reaction it depends on the health condition of individual. So sometimes some people may actually have more cough and phlegm for discharge. Yeah. So this is just a recommended dosage. Yeah, based on Yongkian Ganoderma. Yeah. Next. So in TCM perspective, lung is actually go element in TCM. So there, for information, there are 5 elements in total in TCM perspective. So lung govern regulation of water passage. So refer to lung function in balancing the water in the body. So for example, the amount of water absorbed through food, drink, and after metabolic and absorbed by the body. So the excess will actually excreted in the form of sweat and urine. So if lung is not function normally due to this so-called disorder in dispersion or consolidation and excretion, stagnating lung qi, as a result, it will lead to a symptom like chest tightness, okay, stuffy nose, cough, also cause breathless, yeah, and edema, urination disorder, etc. So qi over here in TCM is actually referred to the so-called healthy energy that actually flow continuously in our body system. Yeah. Yeah. So for the lung, okay, is good for food that is good for the lung, which is in TCM perspective is take those food that is natural in white color. Okay, so for example, the vegetable you can actually choose lily, white radish, and for the fruit you can choose papaya, lychee, and white peach. Yeah, so these are thought to be white color, good for the lung. Yes, in TCM perspective, yeah. Next. Okay, now we look at Stronghold, so-called Stronghold product in terms of the supplement for asthmatic. So for Lactoberry, yeah, Lactoberry is a so-called probiotic or friendly. They actually provide friendly bacteria for our gut. So as we know that 60 to 70% of the immune system is actually located in the gut. Yeah. So now we look at the first one. Yeah. First, number one is that taking probiotic actually improve our allergic, okay, improve the allergic condition, actually reduce the chance of being infected with the so-called allergies among infants. So taking probiotic will have more friendly bacteria that actually able to actually train your immune system to distinguish between pathogens, for example, virus and bacteria, and non harmful antigens. Yeah, it will also prevent your immune system from overreacting to non-harmful antigens. Cause of this is those antigens that actually the cause of allergies. Yeah. So number two, yeah, is actually another benefit is to beef up the immune system. Just I mentioned about 60% to 70% of immune system is located in the gut. Yeah. So with the immune system beef up, you actually lower the risk of a lung infection, cut down the frequency of respiratory infection. Yeah. So young children who actually immune system is constantly in constant state of development until the age of 7. So it's good to actually take probiotic to actually beef up the immune system. Yeah. So next is have an anti-inflammatory effect. So another benefit is that this friendly bacteria will actually lower the CRP. Yeah. So high CRP, the CRP is a marker, is a level, is a marker. So this high CRP means that you have, it's an inflammation marker. So when it's high, it means that you have inflammation. So this CRP is actually stands for C-reactive protein. It's a kind of protein, which is found in the blood, and it's used to actually indicate inflammation. Yeah. So this CRP marker will actually rise in response to inflammation. Yeah. Yeah. Yes. So this is a probiotic. It's a antibacterial supplement. So next, we can consider taking the so-called Chun Cha. So we can take it daily as a normal drink for additional so-called lung benefit. So it is an excellent antioxidant drink, anti-inflammatory. They have actually anti-inflammatory effect. They can actually moisten. Taking this Chun Cha can actually moisten the lung and alleviate cough. So another benefit is to also help to remove phlegm and able to increase the resistance to so-called resistant to environmental stress. So actually, they will actually so-called reduce, okay, your so-called calm you down and all, and reduce your so-called emotional stress and all this. Yeah. So this is Chun Cha have the so-called the benefit. Next. Yeah. So now we look at the testimonial. We have 3 testimonial. So let's look at the first one. So this testimonial is from Taiwan. She had asthma, started at the age of 4 years old, and she was diagnosed with hypersensitive to dust mite, and has been taking Western medication to control the cough and asthma, but the condition still persists and reoccur quite often. Yeah. So at one point she started taking 6 capsules of Lingzhi and 6 capsules of pollen, and she had vertigo reaction due to her condition. She get more cough. Yeah. So after a while, she found that she had less so-called asthma attack and fall sick less. So no more asthma attack after consuming for about 1 year, and her condition continued to improve. Okay, and she had no more asthma attack, although she had stopped after 1 year, stopped taking the Lingzhi after 1 year, and she had no longer had the asthma attack. Yeah. So she's quite happy with the improved condition. Yeah. Next. The second testimonial is a female, actually Madam Ho from Taiwan also. So this is the case of living with a chronic asthma attack for almost 20 years. Yeah, she started to have asthma at a very young age, 10 years old. Yeah, and get very serious. Okay, at one point after married at 20 years old. Yeah, so at the age of 41, she started to consume 2 capsules of Lingzhi and 4 capsules of pollen, and for 4 times a day. Yeah. So with her condition improved, she actually increased to actually 5 capsules of Lingzhi and 5 capsules of pollen, also 4 times a day. Yeah. So after consuming Lingzhi for 3 months, okay, with this dosage, her asthma attack actually, she found that actually reduced, okay, gradually, and eventually have no more attack. So, and no more suffering of this so-called asthma. In fact, this asthma, she has been living it for 20 years. So she was so happy that no more suffering. And now consume the Lingzhi as a maintenance. Yeah. So it shows that Lingzhi actually help the asthmatic patient a lot. Yeah. Next. So the last testimonial is the asthma case of a so-called 3-year-old boy from Taiwan. So this so-called Mr. Tan actually started the asthma at the very young age of 3 years old. So his mother suspected that it could be due to the smoke and motorcycle exhaust pipe. So all the gases, okay. So in the environment, okay. So they actually found that it could be, this is one of the trigger source. Yeah. So when the asthma attack, it actually started with a cough. So this boy, once he got this asthma attack, it will actually started with a cough, and then slowly will have phlegm, and also it suffered from drug allergy. Yeah, I got another allergy is a drug allergy. So his mother actually fed the boy with Lingzhi, actually mixed in the milk, and put half capsule of Lingzhi for every hours. So feed him, since he is still a small little boy. So they every day about 2 capsules. Yeah. So after 4 months of consuming this Lingzhi dosage, his cough and asthma condition actually improved a lot, and then eventually disappear. So he is no longer suffering from this asthma attack. So now he's already a grown-up teenage. Yeah. So yeah. So this is a good testimonial. Actually, Lingzhi help the asthmatic patient. Next. Yeah, next we come to a conclusion. So here are the key takeaway. So the first one is the key to have healthy respiratory system. Yeah, and next is that asthma can be controlled and prevented by knowing what are the source of trigger. So to maintain the healthy respiratory system, right, is the to so-called understand we can actually use medication drug to control, and we know what to avoid. Yeah. Next is the evidence-based research of Ganoderma actually has shown the result that able to address the root cause of the so-called hypersensitive reaction. So it can actually help in this asthma condition. And other stronger product, Lactoberry and Chun Tea, can consider as a good supplement for daily consumption, actually to enhance and improve the overall health and respiratory system. Yeah. So with that, I end my presentation. Thank you.